Students here, yeah. Next on, Swindy. Next on. Will be here. Okay. Because we just couldn't come in. So you just help us to do this. Okay, when the student is in, you just now is unmute. Unmute me, that's all. Okay. Once they leave, once they have discussion.
Minutes comes on. Good morning, Miss. We are doctors here. My name is Dr. Nafi, Mr. Sarah. So today, just want to examine you for a while and to see whether you are safe to go to the labor room. Okay. So far, are you doing okay, Miss? Do you have any chest pain, any shortness of breath so far? Any like heart beating faster than usual? How about feeling like dizziness or like you want to almost like lose consciousness so far? So everything was fine. Okay. How about do you see any increasing bleeding like around your private part? If everything okay, just going to examine for your
I'm just
one.
gonna
Okay.
lift this up, okay?
Okay.
Okay.
Let's see.
Auriya, one, you just lift up the blanket.
Okay, this is estimate the loss. Okay, this is the central page.
Shift.
Yeah, wait. Urinary pad is 100 ml. This one is around 100 ml. This is 600 ml. But this one is the.
Okay, she's telling afterwards she has blood.
Sorry, didn't push the red alert.
Okay.
Red alert. PTH.
Okay, red alert PPH in labor ward, delivery room, this. Okay.
Where will be in? Send advert here, so it's red is fine.
Explain to the patient what's happening.
Okay, Miss. So just now you have increasing like platelets or we call it pecah tumpah darah. So we just want to examine you further once, okay? And we're going to match you surgery, okay? Sorry, yeah.
Okay, one, before this, has anyone given you any injection in your buttock or given you any medication? Okay, right, so I'll just, I'm assessing for the uterus anatomy.
Is it body?
It feels well contracted. Can you come and confirm my findings? Okay, one, do you have any medical conditions? Any asthma, high blood pressure?
So I just think first, okay, that is contracted. Okay. Let's see, is there any placenta? So we have to look for placenta.
Placenta there? Nabil, do you still want me to give medication since the uterus is contracted?
I think if fertilization should be fine, right? Or do you still give? I think we give hydroxyzine.
Okay,
Let's just run
okay, cytosine is here.
okay,
Can you
just give
check the placenta first?
2040 units,
Okay,
800 ml,
We're
run in
giving
6
you,
hours.
we're giving you some medication, okay, Pan?
Yeah, I just want to check the placenta.
Okay, I'm gonna connect this
Okay,
to
to see the two
her
force, the
IV
M1
line.
and chorion, if there is like any missing cotyledons, I just want to see the two veins and
Connecting to
one
the
artery. Okay, let's see if the member regular or not, and let's see if there is any missing cotyledon. Okay, I think placenta is fine. So now it's fine. So,
trauma, is that the seems speculum?
seems speculum. Let's just check trauma. In the meantime, I will check the patient's area first. Okay, Miss, I'm just going to flatten your back and just going to insert insert the cannula.
It's okay, I can take.
You can check the cannula.
Line already inserted, I've given her medication.
Yeah, but take blood for blood count, JSH, and then calcium and lactate as well as a BBG.
Okay, alright, so I'm taking bloods for those. I'm going to take that one. Okay, I think you assess for trauma.
Okay, so
Yeah.
first of all, just
Taking
see the
blood.
discussion of the perineum, if there is any trauma or laceration, and then just the scene
Okay,
speculum, and then to see if there is any cervical trauma. In the meantime, I'm also use the cervical mapping
GSH
to see if to see if there's any bleeding coming out, and then send also for coagulation profile.
some coagulation profile.
Okay, so cervical mapping, like this one.
Okay, I will do the cervical mapping for you.
Okay, so just do the mapping from 12 to 3, then 3 to 6.
Sorry, we're just going to open up
Sorry,
your
Miss.
bawah.
6 to 9, and then 9 to 12. Okay, let's see if there is any continuous bleeding coming out. Okay, but the uterus is bulgy, right?
No, it's contracted.
Okay, just continue perform that thing. Catheter, let's just put inside the catheter.
Yeah, inside the CBD. It's really not for something time for the CBD.
Okay, because there is a 700 cc of water loss, so I think we should give times 3, so it's at 2.1 liter of normal saline. So we can run for the 500 ml first. Let's pack the monitoring to see if patients are hypertensive or not. And then give 500 ml first for 15 minutes, and then the remaining 1.6 liter around 45 minutes.
Okay.
Then we assess the patient's hemoglobin status and then check BP, PR, respiratory as well.
Okay, so I have I'm putting on the cardiac monitor, BP. You just continue doing assessment. BP, SpO2, and I have attached. There's no normal saline. I will run normal saline. I think let's give 1 gram tranexamic acid.
Okay, let's give
1 gram tranexamic acid. I'm gonna give.
Okay, so what is that we're missing here? So So we have a check for tone, tissue trauma. So should we give carboprost?
Yeah, I'm just going to give carboprost.
Okay, Miss, do you have any asthma beforehand? Just want to
I
double
asked
check.
already just now, they don't have any.
Okay.
Okay.
So far, how are you, Miss? Do you feel any chest pain right now? Any shortness of breath?
Okay.
Like any feeling like dizziness, palpitations? Okay. With your just let us know, okay?
Should I uncap? I'm just going to simulate the. Okay, the outer.
Yeah, that's fine.
Oh,
Okay.
Got it.
Okay, then, but if let's say the uterus is still bulky or like not contracted, then we might need to consider other medications. For example, we have prostol and micrograms.
Okay, so 200 mcg microgram of carboprost given. Okay, let's see. What are we missing here? We've checked for tone, we've given the medication. We have checked the placenta is complete. There is no trauma seen. There is coag profile, coag is, we are waiting for the results. Okay, but she's still bleeding. Okay, do you want to call the MO, let them ask for help? Okay, I'm just going to continue with the frontal massage.
Okay, so I was talking about that. So hi, my name is Dr. Nabil here. So today I'm going to refer a case of patient living postpartum hemorrhage. She is a para 1, just delivered 10 minutes ago, but complicated with primary postpartum hemorrhage. So far we have assessed the tone, trauma, and tissue, but still waiting for the thrombin investigation. But for management wise, we have given the uterine massage and have run the normal saline management, and as well as the medical management, which includes the pitocin 40 units of, and then as well as the carboprost and 250 microgram. We also have ruled out any cervical trauma and then any tissue, any missing of placenta cotyledon. So we would like to refer this patient because of the persistent bleeding for the surgical intervention, which include like possibly like bleeding or hymen suturing. So far, yeah, hymen suturing, and maybe consider for the uterine embolization or like cardiac or hysterectomy if this is persistent. So for Miss, do you feel okay right now, Miss?
But what's happening right now is that you're bleeding a lot from your birth passage there. We have assessed to see what is the cause of the bleeding, but we still can't identify the cause. So we have called for our senior to come and help us. Okay. So in the meantime, we're going to give you we've given you some medication to help, and we're giving you some IV drip. Okay, let's see what else can we give.
If you still bleeding, should we activate the NTP protocol?
Yes, let's activate the maternal MTP. And give
But in the meantime, we can give the safe O negative first.
Mm.
Okay, so let's just give safe O negative blood first. Okay.
transfusing safe O and call for MTP.
Is that easy?
Why is she still bleeding? Yeah, let's check. Okay,
Sorry, Miss. Sorry, Miss. Okay, I'm just going to check your if there's any suture. What is the missing?
What are we missing?
Wait, have you applied the high flow mask? Yes, okay, just going to apply the high flow mask 15 liter breath per minute.
I'm going to give you some oxygen, help you breathe better. This is well contracted, right?
the time is 10 minutes. Start now. You can do whatever you want.
Good afternoon, madam. So we are the medical officer here. So we are here to assist you to make sure that your postpartum is managed well accordingly. So this is my assistant. So
It's also because you have 200 milliliter of blood loss, so we will have to give you some active management. May I know your name first? Okay. Can I have? Is it okay that we start the procedure now?
and
We would like to wash our hands.
so ideally I would like to check for the sign of shock to ensure that there is no sign of shock by check the CCTVR, the color of the palm and the temperature of the palm, and also the whether it's well perfused or not, and the urine output is okay. So after the baby is delivered, ideally I would like to check the placenta also, whether the placenta is fully delivered to exclude any sign of PPH, and also to make sure that the so I will expose the patient first. Okay, so there is a blood loss estimated. It's more than 1,000 ml, so we will proceed to the PPH management. Okay. So first we will make sure that the placenta is fully and the baby is already delivered. We will call the pediatric team to check the baby, and we also attach the patient on the continuous cardiac monitoring, and also after we rule out the placenta, then we will put two large bore IV cannula, and for one sample blood investigation, FEC, renal profile, liver function test, coagulation profile, and blood green cross match. And we'll call the blood bank. Assist the assistant to call the blood bank to make sure that there is we ask to request blood for immediate blood transfusion. Okay. So after the baby is delivered, and ideally we would like to active management of the stage of labor. So we will put this one, cover cross one, the patient is delivered, we will
You don't have to adjust it to that. Just put it like it's one.
ideally we would like to inject on the anterior lateral thigh once the anterior shoulder of the baby is delivered. And also make sure that the mother is well hydrated, so we will attach the normal saline with oxytocin vaccine for 40 unit in 500 ml for 1 hour infusion.
For 4 hours.
Sorry, 4 hour infusion. So do we need to attach?
Quick figure here.
So after that, and then we will monitor the vital sign. BP, check whether the BP is not in hypotensive, and also the urine output. Make sure that is strict intake output chart. Also, after that, we'll ask the mother to keep mother well hydrated. We will take some sip of water to the mother, and also.
Other than that, we also would like to check the blood glucose, the dextrose, every 4 hours.
Forget to mention the active management of the stage. We also need to control cord traction, which make sure that to reduce the
When the cord is lengthening, and also when there's gush of blood, and also the uterus is more rounded, we would like to control cord traction and pull out the cord.
So once the patient is still blood loss, then we will proceed to hand on the uterus.
Okay, we would like to do the uterine massage.
Then we already give the ureterotonic agent, so we will do the bimanual compression if in case of the patient is still have blood loss. So we will insert our I will insert our ideally we would like to insert one fist inside and bimanual compress to control the blood. Okay. After that, if the patient is still in blood loss, so I will put on the intracervical balloon tamponade, battery balloon, sorry, to control the blood, and also
Otherwise, we more than that, we also like to put on the catheter to drain the fluid out, to drain the urine out. Then if it's still it still continue to bleed, we would like to send patient to OT and do bleeding suture. If it's not it's still not working, we will like to start with the internal iliac artery ligation, or we will do the uterine artery embolization and send to the interventional radiology.
if our ultimate resolution is hysterectomy if the bleeding is still cannot control. Okay. So after that, if everything is controlled, then we will send patient to the ward. So after ward management, we will monitor vital sign every hourly, and also we will dextrose to make sure that patient is not hypoglycemic, and also adequate fluid management and resuscitation. Then after that, so we'll ask the nurses to check every hourly whether there is sign of acute blood loss, and also PET charting. Okay. Then after that, we will do the symptomatic management in case patient has vomiting or any sign of distress, and we will treat accordingly. After that, after discharge, we will ask the patient to we will counsel the patient on breastfeeding, because breastfeeding is can be strengthen the bonding between the children and between the neonate and the mother, and also to counsel on contraception also. And
also, we will send the patient to postnatal care, and
we will send the patient to postnatal care, and also counsel the patient to attend PPC, pre-pregnancy care, and also we will also like to encourage patient to tell the next doctor they have history of PPH, so the next doctor can be cautioned. So
for the baby, we will also contact the pediatric team and ask them to check the baby well-being as well.
So we would like to counsel on type of contraception. Whether thank you.
Thank you.
So on inspection of the patient's perineal region, so there's one completely soaked pad with the underneath sheet is also completely soaked with blood as well. So currently I would
This looks like our postpartum hemorrhage, so we would call for help, and we will first start with
yeah, so it's
emergency.
emergency valve, so we'll bring it. Okay, so
And then do uterine.
yeah, massage.
We'll check.
Okay, so ideally we'll check for the patient's airway and then make sure that the airway is patent, and then next up we would secure IV line, so we would insert an IV cannula for the patient, and at the same time we'll also catheterize the bladder, and then now we would do uterine massage. To see if the bleeding stops, and next up we'll also be starting the patient on 40 IU of oxytocin and 500 ml of normal saline.
Yeah.
And we'll connect it to the IV line. And next we would give 0.5 mg of ergometrin in case the bleeding is still persistent, followed by or Carbucross 250 mcg would be given intramuscularly to the patient.
Should we do? Just type the eyes open. Okay.
And then even if that isn't controlled, then we'll go with misoprostol 800 mcg. And then once all of this is given, and if the patient is still having bleeding, persistent bleeding, then we would push her to the
OT. We will arrange for the OT, and ask the OR to prepare the patient for operation. So she will have to undergo exploratory laparotomy, and then compression. Before we go to the OR, we will be doing balloon tamponade for the patient. And despite balloon tamponade also, then if bleeding still persists, then only we'll move her to the OT. And then we will do a laparotomy and then do B-range suture. And if B-range sutures are also not helping with the bleeding, then we'll have to do bilateral uterine artery ligation. And we can also do internal iliac artery ligation of the anterior division. And even after that, meaning finally we'll have to do a hysterectomy for the patient.
And at the same time, we would also do a PB examination and also explore and see if there's any tears or any lacerations around the vaginal area or the vaginal mucosa or the cervix to rule out the causes for the bleeding.
Any other
And
cause?
also check for the tone of the uterus initially.
Minutes? 4 minutes.
Now 4 minutes.
4 more minutes.
So 6 minutes.
So, Rabani, so this patient have delivered 10 minutes ago, and with a blood loss of 200 milliliters, so we need to examine this patient. Okay, before that, please introduce yourself first.
So, hi Puan, saya Rabani, medical student. So, house officer. So today, Puan dah mengandung, dah beranak dan Puan dah hilang banyak darah. So sekarang kita orang nak assess Puan punya pendarahan and okay Puan.
Okay, so Rabani, can you please examine the vagina, do the vaginal examination to see if is there any perineal tear?
Okay. So Puan, saya nak check bahagian vagina Puan untuk tengok pendarahan. Boleh saya teruskan?
So the blood loss is very a lot. The incontinence pad is already soaked. So I think we are okay. But can you? Is there any tear there, Rabani?
So on inspection, the suture is I think there's no problem in suture.
Okay, so since the incontinence pad is soaked, so I'm suspecting of postpartum hemorrhage, and this is an obstetric emergency. So I would like to activate the red alert to call for senior midwives, obstetrician, anesthetists, the pointer, and also the scriber. Okay. So Rabani, can you help me to activate the red alert? Okay. Okay. So Rabani, can you so can you check the airway, breathing, and circulation?
Okay.
While
Puan okay ke? So Puan
giving the normal saline, and also
Puan okey ke? Puan boleh bernafas dengan okey?
normal saline given. Is there any endemic symptoms, Rabani?
So Puan ada rasa pening-pening ke? Ada rasa berdebar-debar? Ada rasa nak pengsan ke Puan?
Also, I would like to transfer
So Puan
1 gram of
ada
Zimexit.
makan ubat apa-apa ke? Ada alahan apa-apa ke? So sebelum ni ada masalah kesihatan yang lain. Bila last Puan makan, sebab kemungkinan besar Puan akan ditolak ke dalam OT untuk buat pembedahan.
So and then can you proceed with the physical examination? So you check the abdomen to see for any uterine atony.
Okay. Puan, saya nak check bahagian perut Puan.
No, the bleeding is still ongoing.
So I'm doing physical examination of the uterus. So uterus seems boggy and approximately 18 weeks of
Okay,
pregnancy.
so the uterus is soft, boggy, and larger than dead. Okay, so I'm suspecting of uterine atony. So please do a uterine massage.
So I'm doing a uterine massage.
So is the bleeding still ongoing, Rabani?
Yes.
Okay, so can you proceed with abdominal bimanual compression?
So I'm already inserting my hand into the patient vagina while pressing patient abdomen to do bimanual compressing.
Okay, so is the bleeding still ongoing?
Yes.
So bleeding ongoing. So I would like to start with oxytocin. I will give patients on 5 units of oxytocin. Oh, before that, have you taken the blood?
No.
No, yeah. Okay, so I will take a secure IV line, and then I will take the blood to send for trauma coagulation profile, and also to check the FBC, fibrinogen, and also the renal profile and LFT. Okay. So and then also GXM, so that I can give patient safe O. Okay. So still since the blood is still ongoing, I would like to transfuse 1 pint of safe O. So how's the bleeding right now?
Still bleeding.
Still bleeding. Okay. So I would like to give IV oxytocin 5 unit to the patient. So 5 units IV oxytocin given, and then is it still bleeding?
Yes.
Okay. So I would like to give another 40 unit of oxytocin diluted in 500 normal 500 ml of normal saline and run at 125 ml per hour. Okay, it's given. Is the bleeding still ongoing, Rabani?
Yes.
So I would like to give IM symptometrin, 1 ampule to the anterolateral of the thigh, which is the vastus lateralis. Okay, IM symptometrin given. Is the bleeding still ongoing?
Yes.
Okay, so now I would like to give carbopros 250 microgram. Okay. Right. So IM carbopros given. Okay, so is the bleeding still ongoing?
Yes.
Okay. So okay. How's the vital right now, Armani? Is the patient stable or unstable?
Patient still unstable. Breathing is still ongoing.
Okay. While I'm waiting the anesthetist to prepare the OT, I would like to put patient on Bakri balloon as a tamponade. Okay, inserting the Bakri balloon and alerting the OT. Okay. So right now we are going to send patients to the OT room. Okay, Rabani, and so that we can do internal iliac artery ligation and also Billich sutures. So, and then lastly, I would like to debrief the team. Okay. Thank you very much.